When you take history from patient in exam, then in start introduce yourself. Later on take biodata of patient. Then ask patient why you came to hospital, or what was the reason that you have to come to hospital. After asking the presenting complaint, ask patient anything else you want to tell about your disease. Usually, patients give you most of information at this stage. The reason behind this point was that, when you will start asking questions from patient, then do not repeat questions, which patient already told you. Today in detail we will talk about how to take joint pains history. But at this stage, I want to tell you, that in exam, you may face following condition, while taking joint pain history. Like, patient may present with worsening of joint pains, that is with flare. Patient of SLE may present with swelling of body due to proteinuria. Patient of joint pains with upper gastrointestinal bleed, due to use of non-steroidal anti-inflammatory drugs. So, you should be ready for the above conditions, and you should focus on presenting complaint of patient. Also, I want to suggest you to use this formula while taking history of pain. Lositra. L for location of pain. O for onset of pain. C for character of pain. I for intensity of pain and again. I for intermittency of pain. T for timing of pain. R for radiation of pain and again. R for how pain is relieved. A for aggravating factors. And again A for associated factors. That is the things which could be present with joint pain like fever, swelling and redness, etc. As far joint pain history is concerned, we will ask questions in this sequence. Location. In which joints do you feel pain? In which joints pain started initially? Among these joints involved, in which joints you feel more pain? Onset. From how long time you have pain in your joints? From which duration you have more pain in your joints? Character. What is the nature of pain? Intensity. Can you tell me about the intensity of pain in your joints? Intermittency. Pain is persistent or intermittent. Timing. At which time of the day you feel more pain? Relieving factors. Can you tell me how pain is reduced? Which medications cause reduction in pain? Aggravating factors. Can you tell me how pain is aggravated? Associated factors. Ask following related questions. Is there swelling of joints along with pain? Is there any redness on joints? Do you feel crepitations on movement of joints? Do you feel stiffness in your joints? If yes, then at which time and how long? Do you have fever, weakness or weight loss? Do you have lumps in your body at any site? So till this time, by asking these above questions, you will be able to recognize your case, that where your history is going. Now this is time to make differentials. Ask to patient, do you feel any irritation or redness in your eyes? Ask about ulcers in oral cavity, hair loss, photosensitivity. Ask to the patient, do you have any difficulty while swallowing? Is there any tightening of skin? Ask, is there any change of color of your fingers while in cold season or in water? Ask, is there any difficulty in breathing? Ask to the patient, is there any difficulty while standing from sitting position? Do you have difficulty while combing hairs? Is there any history of loose motions or burning urination? Ask to patient, is there any history of sore throat in past? Pain persist in the same joint or it moves to next joint while previous joint become normal? Ask question to the patient, do you boil milk before drinking? Is there any direct contact with animals? Ask about use of medications before development of joint pains. Now at this moment, ask questions from head to toe in systemic review. These questions should be related to your case. Ask about shortness breath, abdominal heaviness and pain, and about any rash, etc. Remember, you should be very concise at this moment of systemic review. Now at this stage, in functional status of patient, ask to patient, can you perform your daily activities or you need help of others? Ask to the patient, can you go to washroom? Can you change your clothes? Now at this time, ask about treatment history of patient. Ask, is there any history of blood transfusion? Have you ever been admitted to hospital due to joint pains or for any other reason? Which medications are you taking for joint pains? Do you get any relief by taking these medications? Do you take your medications regularly? Did you ever face side effect of medications you received before? Ask to the patient, is there any history of similar disease in family? Ask personal questions relating to joint pains like extramarital relationships. I hope this video will help you while taking joint pains history. If you have any question, then you can ask in comment section. Like and subscribe our channel for next coming videos. Thank you.